Hi, I'm Melanie Chacon with TooeleTV, and we are at Elton Park today, and we're here with Amy Bate. Amy Bate is the Health Promotion Director for Tooele County Health Department. Thanks for joining us, Amy. So tell us why we're here and what this event is about.
Okay, so we received a grant as the health department, and part of it is to focus on suicide prevention, and we wanted to have a community-wide campaign, and we have called that campaign With Help Comes Hope. You can see behind us the banner, and we've just recently purchased a billboard off of I-80, and this message will be for our community to see for the next year. We're going to try to change it up a little bit, but it will be the same message that when people get help for their problems, they will be more hopeful and be able to heal and get past whatever it is that's bothering them. So we're really just wanting the community to come together and work to help people that are in need and ultimately prevent suicide.
I like that. I like how your theme is hope and not kind of dwelling on depression and whatnot. So you had some speakers here earlier, and one of them gave a really eye-opening statistic. They said that suicide is the 7th leading cause of death in the state of Utah and the 1st leading cause of death amongst youth in Utah, which is really eye-opening, really sad. So obviously that's an issue. But what specifically brought you guys to create a program for it?
Okay, so with public health, one of the programs we focus on is violence and injury prevention. And in the past, behavioral health has been the organization to work with suicide prevention, but they did more as far as intervention. With a public health approach, we can talk generally to the community and reach more people and try to help people before they get to the point where they need behavioral health counseling or treatment and things like that. So we're just trying to make the subject of suicide not be so taboo, get people comfortable talking about it, get people comfortable knowing what to look for, different warning signs, and then teaching them how to ask the question of someone if they're concerned for them, are you considering taking your life? And once they do that, knowing where to go to get help, because we don't do counseling ourselves, but we want to refer them to quality counseling. So that's really a big part of this, is training young people, community members, everyone on what to look for, what to be concerned about, and then persuading them to get help and everyone knowing what resources are available out there.
So part of the programs that you offer are also in high school. What was that program called again?
Okay, so it's a community collaboration. So the health department's kind of overseeing the grant, the Positive Community Norms campaign is what it's called. So we're having a positive message out there. That's what the health department's involved with. With that, we collaborate with the school district, and the school district has a new program called Hope Squad, and that is peer-to-peer mentoring. The young people were chosen by their peers as people that they would turn to if they had a problem or someone that they trusted and couldn't confide in. So those young people were selected by their peers, and the counselors kind of looked at that list of people that were chosen and, approved, and then they trained those young people on how to be a part of the Hope Squad. And the Hope Squad is in every secondary school, so all 6 high schools and 3 junior highs throughout the school district. And it's, like I said, peer-to-peer mentoring. It's not just suicide prevention, it's how to be friends with someone if they're down, how to be empathetic, how to stick up for people if they're being bullied. So it's a really great program. And that's not the only thing that the school district is doing. They've also implemented a new curriculum this year called Second Step, and that's K through 8. And it's a character education along those same lines, that eventually will help with preventing suicide. Tooele City has been awesome. Tooele City Communities That Care, they've put out a brochure with all kinds of information and help for people, even for families that are dealing with grief and healing. There's a lot of great resources in that brochure. They've been a great community partner. They're also involved with the QPR training, which is Question, Persuade, Refer, and that is training individuals in the community on what to look for and what they can do. Tooele City Law Enforcement, one of their officers is very involved, and she is a QPR instructor, and she's also a postvention instructor. And postvention is how we should handle a situation in the community if someone does take their life, because a lot of times the way that that is addressed can either help or hurt. We want to make sure people are doing things correctly so that the message is out there that even though something tragic may have happened, let's take care of this family and let's not let that happen again. QPR is like CPR, and we want people trained as first responders so that they know what to do when they see someone in need of help and refer them to the services, where they're not the ones that are actually, going to be performing the heart surgery. As with CPR, it's just those first responders getting them to that place where they need help. And we would like for, as many people in the community to get training, because the more people that have that training, the better off we'll be, because then, we'll have so many people looking out for each other, helping one another, and we just want everyone to be involved. Even if they don't get the training, we want people to understand, warning signs or how they can refer, or how they can just be a kind ear to someone in need. So.
Amy, what would you say to somebody that's feeling lonely, depressed, maybe thought of suicide, even contemplating suicide right now?
Okay, so I would take them with me. That's the best thing you can do to get help. I would, explain to them that I do care, and that they are important, and that if they get the help they need, they've found that a person may never be suicidal again in the future. So it's really just a matter of getting them that professional help. So there are a lot of different ways of doing that. The National Suicide Prevention Lifeline is on the billboard. We have contacts here in our county. Of course, you can always call 911. You can call dispatch. You can take someone to the hospital. There's a lot of different ways of getting people help. It's basically, you don't want to leave them alone, and you want to persuade them to live, because they are important. And then, show them that hope, because we have found that truly with help comes hope. And if people are hopeful, they won't consider taking their lives.
True. Well, you guys have thrown around the word family so much today, and I love that, because every time I come to Tooele, I really see that you guys are such a family-oriented community, and I love that you guys want to think of each other as such. And I think this is a fantastic program. Thank you so much for putting on this amazing event, and we're glad that we were able to speak with you today.
Thank you. We appreciate it. It's been a lot of fun.